Hello guys, welcome to our channel. Today we are going to discuss about the FMG June 2026 session, how we are going to start the preparation and when and how to manage everything. I'm going to explain in this video. So let's start with the preparation, how we are going to start with for the FMG June 2026. For example, there are the two people that going to appear for this examination. First time those who are appearing for the examination, and also those who are doing the second or the other attempt that they are going to give, those who couldn't clear in the last examination. So what I want to suggest for these students, please take a break like 1 to 2 days and just analyze the things, okay? Because you already know the pattern of the examination, I would suggest you guys to analyze. What to analyze? For example, what are the mistakes? Is it the silly mistakes or it is going to be the blunder mistakes? So please analyze and get to know where are the mistakes went, and give a break and analyze your performance also in the last examination, so that you can clear cut, you can get back to the FMG examination preparation. So you already have the experience of the examination. So what are the miracle is going to happen? Who knows, you are going to score this examination with a 200 plus. So what I am building here, I am building here the positive environment. Don't think this is the attempt that you are have in the last attempt you couldn't clear. It doesn't mean that it is the last time, because who knows, with the consistency and with more preparation strategies, you're going to give the next examination with a 200 plus score. All right, next, coming to this batch, you are going to appear for this examination for the first time. What you have to do? Okay, first thing and foremost thing, you have to analyze in your last 5 years what is your basics and what is your concepts, because nowadays FMG examination is more about the all 19 subjects. Before that time there will be like major subjects and pre or the paraclinicals or just minors, they are going to clear the 150 plus examination score easily. But nowadays it is very critical, and for that you have to make sure that 19 subjects you have to read, and you also have to score the 200 plus. Okay, this is the first thing that you have to keep in your mind. Next, coming to the preparation strategy, and these preparation strategy, I would suggest they are the two phases when you are going to give the examination. So we all know that exam date is June, right? June, in the June examination, mostly it is a tentative. It can be postponed to the July like first week, or the June last week, or the July first week it going to be the examination. So what is the first thing that you have to make sure? So they are the 6 months phases, guys. For example, February and March, April, May, June. Okay, let's keep until the June. So I would suggest you guys to first 3 months you have to thoroughly read the all the 19 subjects. Okay, so read all thoroughly 19 subjects, and then coming to the May and June, keep it only exclusively for the revision and also practice. Okay, so when you are reading and completed the revision and then practice, this all going to sum up for the 200 plus score. Okay, this is for sure shot. Okay, it is not about the PYTs or not about the PYQs. If you done this best way, the 19 subjects plus the revision and the practice, I am damn sure many of the students, those who are cleared also, you can ask them that this strategy is going to help you a lot. Okay, so how you are going to read this first 19 subjects? I would suggest first start with the anatomy and the physiology. Okay, then pharma and patho. So these are like preclinicals and also your paraclinicals. And if you are perfect in these clinical subjects now, you are going to easily cakewalk the surgery, medicine, and also pediatrics, and for example obstetrics and gynecology. All this will be cakewalk for you. And after this, complete these last subjects minors, which is going to give the full-fledged preparation for the first strategy. Okay, this reading should be done for the all 19 subjects. I am not just excluding. You might see only these subjects are mentioned, where the other subjects, other all subject I have included in the minors only. So because these are the major chunk, if your concepts are clear, you are going to easily win the all other subjects also. Okay, first start with the anatomy, physio, pharma, patho, and then going to the major subjects and minor subjects. Okay, this is the strategy that you should follow, and you can easily get back to this. Next, coming to the resources. Okay, so there are many resources that is available in our hands nowadays, right? So from beginning from your university, from the online resources, from the offline resources. There are plenty of that. So in that, don't go FOMO. Okay, you are missing something, or your friend is using something, you are unable to get, you are unable to complete. Don't stick to that. Okay, you always have to be the one source. Okay, and that one source should be end of the examination. Until the examination is finished, you have to stick to that one resources only, because this is going to help you a lot in the many ways. Let me show you one example. For example, you are using one resources, and this resources is helping you to practice the MCQs, and if this is helping you to solve the MCQs, if this is helping you to the revision, or it can be helpful for the revise, understanding the concepts, and then you have to stick to that. Now if you are going to move to the next resources, second option, what it will do, it will create the confusion for you. Okay, this confusion is not good for the examination, because four options, obviously the first and fourth will be eliminated. You are left with the second and third options, but these confusion will literally stuck you between these two options. So to avoid this confusion, better stick to the one resources only. Na, this will be helpful for you in the last minute. Okay, no confusion, no distraction, anything. So I would suggest just stick to the one resources, and that resources should be you are able to practice the MCQs, able to do the revision, and able to revise by yourself, and understanding that concepts is important for you, and whichever is helpful for you, you can follow that. Next, coming to the MCQs, and in the beginning phases, MCQ should be 20 to 30 per day. Okay, first revision in the first 3 months, that should be the first thing. And next, after that, 20 to 30, gradually increase to 40, gradually increase to 50, gradually increase to 80, and then 100 plus MCQs. So your score also has to be like this only. There should be incline only, no decline. Okay, the graph should be maintained just like your practice. Also your scores have to be reflected. Next, coming to the grand test strategy. So what I said, first 3 months is going to be purely for the reading only. In this, you have to give 1 to 2 GT per month. Okay, 1 to 2 GT per month for the first 3 months. Okay, then after that, next, going to this revision phase, you have to give the 3 GT per month. Okay, 3 GT per month you should be follow in the last revision period. And the first thing that you will get into your mind, how can we analyze? So analyzation, if you are spending on the GT, this will help you for the time management, and also help you for the pros and cons. What is your pros and what is your cons that you are going to get? Okay, if you can't digest those pros and cons, you have to review the examination, right? This GT should be reviewed thoroughly. How you are going to review? For example, they are the 5 modules, right? If you are given these 5 modules, at least one module per day. Okay, one module per day. If you review also, you can easily review this in the 4 days. Okay, and you can take note what are the mistakes, what are the performance that you are, which subject you are perfect, which subject you are weak, which questions are you are making the silly mistakes. That all going to be known in this revision and reviewing of your performance. Okay, I would suggest review is must for your GT. Next, coming to the what else is left, everything was explained here. What else is left? The thing that is left here is the consistency. Okay, you have to be consistency maintained along with the confidence. Okay, this is the important thing, guys. These two are going to cook you to better food in the examination. Okay, that is the first thing that I would tell. Be confident and be consistent to your plan. This 5 to 6 months is going to be the not major chunk of your life. Okay, very small period, and if you give best in this 6 months, now you are going to see greatest adventures and greatest success in your life. Okay, this is the first success that you are going to see. So I would suggest, trust yourself, trust your resources, and trust the confidence. Build your confidence by solving the MCQs, by reading the lectures, and by reading the notes and revision. Okay, so you have to maintain this till your last examination. Okay, and all the best, guys, those who are going to kickstart for the first revision, and also those who are going to attempt for the second attempt, or the guys who are attempting for the second attempt. I would suggest you one thing only, guys. Just be confident. Okay, the one time fail is not going to decide you anything, and the next when you are coming back, you have to show yourself how perseverant you are and how competitive and the competent by yourself that you have to prove. I know you're all going to prove yourself that you all are going to be give the successful scores in the final examination. All the best everyone. Those who are new to this channel, please do subscribe and share with your friends. I'm going to upload the new videos on the how the strategies and the rapid revision lectures, short topics in your channel. Okay, so until then, stay tuned. All the best guys.